Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to our presentation on management of dental patients with compromising medical conditions. In this series of slides, we will focus on how to handle dental care for patients with specific medical issues. We will go through endocrine disorders, that is adrenal insufficiency, hyperthyroidism, and hypothyroidism. First, consider the management of patients with adrenal suppression who requires major oral surgery. We will cover the protocol and procedures necessary to ensure safe and effective treatment for these patients. Adrenal suppression can complicate surgical procedure, and it is important to follow specific guidelines to minimize risks and promote recovery. This condition can be caused by diseases affecting the adrenal cortex or by long-term use of corticosteroids. It is important to recognize symptoms like weakness, fatigue, and hyperpigmentation of skin and mucous membrane. A patient on long-term corticosteroids often shows signs like a moon facies, that is a moon-like face, and buffalo humps. Their inability to increase endogenous corticosteroids level in response to physiologic stress. So, during stressful dental procedures, they might experience serious symptoms like low blood pressure, fainting, nausea, and fever during complex prolonged surgery, indicating an adrenal crisis. So, need careful monitoring and possible steroid supplementation. For patients with adrenal insufficiency needing complex oral surgery, it's crucial to talk to their primary care physician about extra steroids. For minor procedures, reducing anxiety is usually enough, but close monitoring for adrenal crisis signs is still important. When a patient is currently on corticosteroids, needs major oral surgery, it is important to reduce their anxiety and closely monitor their vital signs. Their steroid dose should be double around the time of the surgery on the day before, day of, and day after, and then return to normal shortly after surgery on the second post-surgical day. For patients who have taken steroids recently but are not currently on them, a specific steroid regimen is necessary. This involves taking 60 milligram of hydrocortisone before surgery and gradually reducing the dose after the procedure to prevent complications. These guidelines on the management of patients with adrenal suppression who requires major oral surgery are provided in your textbook. These guidelines are divided into two sections, one for patients currently taking steroids and another for patients not currently taking steroids. Now let's explain these guidelines one by one. That will be the almost the repetition of the above slides. First, let's examine the guidelines for patients who are currently taking corticosteroids. For patients currently on corticosteroids, it is crucial to manage their anxiety and closely monitor their vital signs. These patients need to double their daily corticosteroid dose on the day before, the day of, and the day after surgery to prevent adrenal crisis. By the second day after surgery, they can return to their usual dose. Now let's discuss the approach for patients who are not currently taking steroids. For patients not currently on corticosteroids, but who have taken them in the past year, it is important to manage anxiety and monitor vital signs. These patients should take 60 milligram of hydrocortisone the day before and the morning of the surgery to prevent adrenal insufficiency. In cases where the patients cannot take oral hydrocortisone, the dentist can administer it intramuscularly or intravenously. After surgery, the steroid dose should be gradually reduced over the next six days, starting with 40 milligram for the first 2 days and then 20 milligram for the next 3 days. By the sixth day, supplemental steroids can be discontinued. For major surgical procedure, it is often best to hospitalize the patient to ensure they receive proper care and monitoring. Always consult the patient's primary care physician if there are any uncertainties about the need for or dosage of supplemental corticosteroids. In summary, managing patients with adrenal suppression undergoing major oral surgery involve careful monitoring, appropriate adjustment to corticosteroid dosages, and potential hospitalization for major procedures. Collaboration with patient's primary care physician is essential to ensure the best possible outcomes. Next is hyperthyroidism. Particularly, hyperthyroidism is a concern in oral surgery. Causes include Graves' disease and thyroid adenomas. Early symptoms include hair and skin changes, fast heart rate, and weight loss. Exophthalmos is also common. Hyperthyroidism is diagnosed by measuring thyroid hormone levels. Treatment involves medication or surgery. If untreated, patient risks a thyrotoxic crisis, which can lead to severe symptoms and potentially death. For patients with hyperthyroidism, it is best to wait until their condition is controlled before doing surgery. Monitoring their vital signs and limiting epinephrine use during procedure is important to avoid triggering a thyrotoxic crisis. These guidelines are provided in your textbooks for the management of patients with hyperthyroidism. Now, let's talk briefly about hypothyroidism. Hypothyroidism shows symptoms like fatigue, weight gain, and dry skin. Mild symptoms typically do not require changes to the dental treatment, but recognizing these signs can help with early diagnosis and management. To sum up, managing dental patients with medical conditions like adrenal insufficiency and thyroid disorders is crucial. Working with the patient's primary care physician ensures safe and effective dental care, preventing complications during and after procedures. Thank you. Wish you best of luck.